Well, one of the other things that I'm just going to touch on very briefly is pain. We're incredibly bad at assessing and treating pain in people with dementia. And that's not because we're all neglectful, it's because it's actually very hard to recognise pain in people with dementia. But people with dementia get far less analgesics than somebody of the same age without dementia. And I mean, there's no real evidence that people with dementia are less likely to get pain. So I think what we're really doing is just not recognising it and not treating it properly. So we were involved recently in a study with some colleagues in Norway, which is a randomised trial of stepped care pain control, mainly using paracetamol in 60 care homes. 30 got the treatment, 30 got usual care. And we were treating people whether or not they had identified pain at baseline. In the group that got the active treatment, the other group got usual care. And the group that got active treatment did about 8 points better on the Cohen-Mansfield agitation scale over the 8 weeks of the trial. The agitation got worse again once the analgesia was stopped. So I think this is very good evidence that actually analgesia can play an important role in reducing agitation. And I think probably the way of interpreting it for me is that an awful lot of people are agitated because they're in pain and we're just not recognising it. And we probably recognise very severe pain, but I mean, I don't know what you're like, but even if I have a relatively moderate level of pain, I become a nightmare. If I have a headache, it's probably the equivalent of man flu. I get a headache, it's the worst headache anyone's ever had. I'm completely grumpy to anyone around me. And I think, people with dementia are no different. I mean, if they're having a bad day and they've got a headache and their arthritis is playing up, they're far more likely to be agitated and irritable. And I think it shows that just dealing with that pain a little bit better really does improve agitation. But importantly, it did also improve their pain, which was kind of also vital to know. We used a scale in this study called MOBID, which was developed by colleagues in Norway, but is available in English as well and has been well validated. And the really nice thing about this scale is it assesses the way that pain affects function. So it makes it a little bit easier to assess pain in people who can't tell you they're in pain. So I think it's actually quite a good tool for picking up pain. And I must admit, it's changed my own practice. I mean, if somebody's agitated and not responding to drug treatments, even if there's no obvious pain, I will now often have a trial of paracetamol before thinking about other kind of drug options. It's safe, and the evidence is that it's effective in a significant number of people.